Hi, welcome to our telehealth medicine information video. I'm Garvin, and this video is on Butran patch. So Butrans patch contain the active ingredient buprenorphine, which is a very strong opioid painkiller related to morphine. So what are Butran patches used for? Butran patches are used to treat ongoing moderate pain that can't be relieved by weaker non-opioid painkillers. For example, long-term pain caused by osteoarthritis. How do Butran patches work? Butran patches contain the active ingredient buprenorphine, which is a type of medicine called an opioid painkiller. Opioid painkillers work by mimicking the action of naturally occurring pain-reducing chemicals called endorphins. Endorphins are found in the brain and spinal cord and reduce pain by combining with opioid receptors. Buprenorphine mimics the action of natural endorphins by stimulating the opioid receptors in the brain and spinal cord. This blocks the transmission of pain signals sent by the nerves to the brain. Therefore, even though the cause of the pain may remain, less pain is actually felt. Butran patches contain a reservoir of buprenorphine that passes slowly from the patch through the skin and into the bloodstream. The blood level of the medicine rises slowly in the first 3 days after the first patch is put on, so the initial effect of the medicine is not rapid, but after this the blood level of the medicine remains steady. The patch should be changed every 7 days to provide continuous pain relief. So, how do you use the Butran patches? The patches should not be divided, cut or damaged in any way. Butran patches should be applied to a clean, dry, non-hairy, non-irritated, non-broken area of skin, preferably on the upper outer arm, upper chest, upper back or the side of the chest. Avoid areas with large scars. If you need to clean the skin before sticking on the patch, use only water, not soap or other cleansers. If hair needs to be removed before applying the patch, it should be cut with scissors, not shaved. Don't stick the patch on straight after a hot bath or shower. Wait for the skin to cool down first, and don't use talc, creams and moisturisers before applying the patch, as they may prevent it sticking. Stick the patch on straight after removing it from the sachet and press it firmly into place with the palm of the hand for 30 seconds. While you're wearing the patch, you can swim, bathe and shower as normal, but you should avoid exposing the patch to excessive heat sources such as hot water bottles, electric blankets, heat lamps, sunbeds, saunas or hot baths, as heat increases the absorption of the active ingredient into the body, resulting in a greater risk of side effects. So tell your doctor if you get a fever, which is a high temperature, while wearing the patch, as it might also increase the absorption of medicine through the skin. Each patch should be worn for 7 days and then removed. You should always change your patch at the same time of day. New patches should be applied to a different area of skin, and you should avoid using the same area for the next 3 to 4 weeks. If a patch starts to peel off at the edges, it can be stuck back down at the edges with skin tape. If a patch falls off before it needs changing, stick a new one on straight away, and remember, this replacement will need changing after 7 days. Removed patches should be folded in half, sticky side innermost, and placed inside the open sachet or piece of tin foil for careful disposal away from children and animals. This is because used patches may still contain some of the active ingredient and it can be harmful to children or animals. Don't use more than your doctor tells you to. So no more than 2 patches should be worn at any one time. And some important information about the Butran patches. The medicine may cause drowsiness and various other side effects that could impair your mental or physical ability to drive or operate heavy machinery, particularly when you first start using the patches or after any dose increase. You should be aware of how to react to this medicine before driving or operating machinery. When you first start the patches or after any dose increase, you should not drive or operate machinery while wearing a patch or for at least 24 hours after removing the last patch. And also you should avoid drinking alcohol while using the patch, as alcohol is likely to increase the risk of you feeling drowsy or dizzy. So what are the possible side effects of Butrans patches? So itching or other reaction of skin at the patch application site, headache, dizziness, drowsiness, dry mouth, constipation, nausea and vomiting, hot flushes, itching, feeling weak or tired, loss of appetite, confusion, depression, nervousness, difficulty sleeping, which is insomnia, pins and needles sensation, shortness of breath, abdominal pain or indigestion, diarrhea, rash, sweating, retention of fluid caused by swelling or causing swelling of the ankles, which is peripheral edema, and chest pain. So you need to speak to your doctor or pharmacist if you want any more information about any possible risk or side effect associated with Butrans. So can you use other medicines with Butrans patches? Well, first of all, it's important to tell your doctor and pharmacist what medicines you are already taking, including those bought without a prescription, and herbal medicines before you start treatment with this medicine. And similarly, check with your doctor or pharmacist before taking any new medicine while using this one to make sure the combination is safe. So this medicine should not be used by people who are taking a monoamine oxidase inhibitor or an MAOI. For example, the antidepressants phenelzine, transcyclopramine, isocarboxide or moclobomide, or people who have taken one of these medicines in the last 14 days. There may be an increased risk of side effects such as drowsiness, sedation and slow, shallow breathing if this medicine is used with other medicines that have a sedative effect on the central nervous system. So these include the following: so alcohol, antipsychotics such as haloperidol, chlorpromazine, barbiturates such as phenobarbital, the benzodiazepines, which would be oxycam or diazepam, temazepam, and these should not be taken while you're using Butrans patches. Also general anesthetics, the general muscle relaxants such as baclofen, other opioid painkillers such as morphine, codeine, sedating antihistamines such as Piriton, sleeping tablets such as Zimovane or Zopiclone, the tricyclic antidepressants and amitriptyline. And the following medicines may increase the blood level of buprenorphine, and as a result you may need a lower dose if you're taking one of these because you'd get more side effects with higher blood level. Azole antifungals such as itraconazole, ketoconazole, the macrolide antibiotics such as erythromycin or Clasid, protease inhibitors for HIV infection such as ritinavir, and the following medicines may decrease the blood level of buprenorphine and therefore make it less effective: carbamazepine, which is for epilepsy, phenobarbital, phenytoin, rifampicin, and the herbal product St. John's wort. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact us through our website mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork, or ring 436-6923 to find out more. Thank you for watching. Stay healthy and stay informed.